Diabetic foot is really a problem with people with diabetes. It's one of the major complications of diabetes itself. And one of the problems in diabetic foot is the circulation. Because of having high sugars for a period of time, the arteries become narrowed, and therefore the flow of blood is not adequate to the lower parts of the foot and even the hands at times. And that also now leads to diabetes neuropathy, meaning the nerves that make people feel pain becomes dysfunctioned. So the two major problems with diabetic foot is circulation and nerve damage. With nerve damage, it means people cannot feel pain. And if they can't feel pain with these small little pricks, then they cannot take an action. And with the time, because the prick stays in situ for a period of time, and that leads to infection. Remembering that again circulation is poor, therefore the delivery of antibiotics and the immune response to the feet is minimal, so therefore the infection becomes hard, difficult to treat. And that infection can lead to gangrene. Gangrene means the dead tissues become black, the tissues that are alive become black, and then gangrene now leads to amputation. And yet there are very simple things we can do to prevent such, by screening every person who has diabetes, screening and identifying high risk foods, and then teach them on how to change their lifestyle and avoid risk behaviors like walking bare feet, like doing home surgeries, and also reporting to healthcare providers as soon as they identify a problem, could be able to help prevent further damage of the tissues and prevent amputation. We also do the screening to identify a normal foot, and then we teach the patient to keep it as low profile as possible to avoid getting to neuropathy and structured vomiting. That it can lead to callus. Callus is the hard skin under the foot. Can lead to corns because of the pressure on the shoe. And those are the things when we do the screening, we are able to identify in time and then use the same profile after categorizing the patient, and we teach them.